Oh, yes, the video. So have a look at it, enjoy.
An ultrasound beam can be brought to a tight focus at a distance from its source, with sufficient energy concentrated within the focus. The cells lying within will be killed without damaging the surrounding tissues. High-intensity focus ultrasound, HIFU, is, therefore, a non-invasive method of producing selective and trackless destruction of deeply seated tissue targets within the body without causing any damage to the overlying surrounding tissues. Ultrasound-guided HIFU involves HIFU ablation under the guidance of real-time ultrasound imaging, which can achieve an uninterrupted visualization of tissue coagulative necrosis during the treatment via grayscale changes in real time. The ablated lesions demonstrate an echogenicity or grayscale changes in the ultrasound images after the sonication, which enables immediate assessment of patient's response to ablation, ensuring a safer and more controllable therapy. Imaging fusion and three-dimension digital reconstruction function provide doctors with a much clearer vision during the whole procedure. Thus, doctors can finish the treatment with ease. Ultrasound-guided HIFU, a new option for the gynecologist to manage uterine fibroids and other gynecological benign tumors, can maximally preserving the integrity of the uterus. No surgery, no bleeding, and no anesthesia. Patients can even chat with doctors during treatment to ease their tension. Patients can go home in nearly 2 hours after the treatment and resume normal life the second day after treatment. Post-operative MRI may still detect the presence of ablated lesions. However, vascularity is now absent in the ablated region, as the ablated lesions will gradually shrink or even disappear over time. The symptoms will also be gradually alleviated or eliminated. Ultrasound
Okay.
HIFU for gynecology.
Olarik, I had some tone problems here. I don't know whether you had it also. I heard everything a little bit interrupted. What about you?
I will check it.
It was okay for you?
Yes, it's okay for me. There's no any voice.
Okay. So let's go now to the next slide, please.
Okay, sure.
Okay, go to the next one. All right. So essentially is, as I told you before, the patient is laying on her belly on the machine, and the ultrasound beams are coming from under her, and they are concentrated on the myoma or the adenomyosis. Okay, if we have a look how we can treat myomas, we have on the left side, you can do it with traditional laparotomy, big scar. You can do it with laparoscopy. They call it minimal invasive, but still not no invasive. With the HIFU ultrasound ablation, and by the way, that I forgot to tell you, we are talking about ultrasound guided HIFU. This is not the same as the MRI guided HIFU that is very popular in the US. The problem is that the patient lays on her belly in the MRI machine for 1 to 3 hours. Just imagine in the tunnel, the patient is laying there 3 hours. That is terrible. with the ultrasound guided machine, the patient is laying in a room. She can talk, she can drink, whatever she wants. So the ultrasound guided therapy is much nicer. And on the right side, you see that there is no contact between the ultrasound transducer and the body. That means there are no scars, no damages to tissue, no bleedings, practically no pain. However, we need to take care that the beams are going through the skin. And I learned in Chongqing that some of the patients say, oh, my skin is hurting. Well, then you need to change the position of your transducer. That is all a training effect. Huh? So now we go to the next slide, please. Olarik? Yes, here again. That are, I learned all over the world that patients, especially women, want everything with exception one, skin damages, scars. So even if after laparoscopic procedure, we say the patients, you will have only 3, 4, 5 small incisions, for some patients that is still very problematic. So with HIFU, you see, there is no skin scars at all. There is nothing what harms to the patient on the visible. What is going on in the abdomen, the patient don't see that. But on the skin and at the surface, there's nothing what can be harmful to her. Next image, please. Yeah, here again, surgical myomectomy. Everybody of us have done this 20, 30 years ago. Laparotomy, myomectomy, very traumatic. Laparoscopic procedure, minimal invasive. HIFU, non-invasive at all. And that is what we are fascinated. It's a little bit against us because we are laparoscopic surgeons, but I think still for us, we should say, even if laparoscopy is minimal invasive, non-invasive therapy could be even more, from advantage to the patient. Next one, please. Yeah, this slide is the only one I'm going to show you. This is just to say that in England, NICE accepted to have HIFU, also ultrasound-guided intensive transcutaneous ultrasound, as a possibility of treating myomas. So they designed guidelines, and it is in England a treatment possibility that is even paid by the National Health Service. England was the first one who did it. Till now, I don't know whether we have Chinese friends online, but till now, the complete information we got on HIFU was coming from China. And unfortunately, in Europe, but especially in the US, everything what came from China was said, yeah, China is okay, but we want our own data. So that is the reason why the ESGE working group now said, we want to collect our own data, publish our own data, have ideas from our side on safety and efficacy. And that is the reason why, especially Professor Rudy and me, decided to have this working group and to promote this technique in our reference part of the world, but is especially big Europe, including Russia, Ukraine, Belarus, of course the Middle East, and some parts of Southeast Asia. We realize, of course, that HIFU is very popular in China, a little bit more in Taiwan, in Singapore, and maybe also, especially in South Korea, but that's all. So we want to have this technique to be popular and introduced to the rest of the world, where we influence to, and we are fascinated and convinced that this technique is a good technique for our patients for the non-invasive therapy of myomas and adenomyosis. That is another subject. We can talk about adenomyosis for 5 hours. Olarik, that's all what I wanted to say for my side, and now it's up to you. I think there are many people who want to give remarks and ask questions.
Yes, Professor Hugo, can you hear me?
Yes, I hear you very well, Olarik.
Yes. I have some questions, right? We know that there is a lot of the type of the myomas: intramural, submucous, subserous. So what do you think the HIFU is suitable for which type of the myoma?
Yeah, that is one of the questions that we also in the ESGE were discussing. Yeah, of course, we should be very clear that a subserosal myoma, a stealed myoma, that you can remove during laparoscopy in 5 minutes is still the best option for laparoscopy. But all myomas who are really in the wall, intramural myomas or adenomyosis, where we can only remove this with incisions, bleeding and everything. So that are the patients where we think we should consider HIFU. So the intramural myomas, okay, it's not always so easy, but the intracavital, so that we can remove with hysteroscopy, and the subserosal, where we can do an easy laparoscopic removal, that's not the problem. The problem are if the complete uterine wall is filled with myomas or adenomyosis. What do you want to do? You want to give medicaments. We're not going to talk about that now. You can do surgery, but after surgery, the uterus is gone. Eh? So that is, in our opinion, I want to stress again, I'm a beginner. Yeah. So I have not like Professor Chiang in China, who has 25,000 cases. I think for me, the intramural myomas and adenomyosis are the optimal option for this technique because it's atraumatic for the patients.
I see. So, in your experience, what about the success rate of the treatment?
Oh, let me tell you again, I am a beginner. Yeah, I've been to Chongqing now 3 times. I worked with experts, And if you see the Chinese experience, so their publications also are in very very good international journals, yeah, that we can say that the success rates, the recurrence rates, the side effect rates is very high or very low. So that is the reason we say we want to prove that, whether that's true, because everything is coming out of China. I trust the Chinese, but the Americans don't trust the Chinese. Yeah, so they want everything to be done again. That's what we want to do. But till now, I must say what I saw in China, it's remarkable, yeah, that we have for the infertility patients. Yeah. Once again, Olarik, if you have a patient of 55 years old with a myoma, with 10 myomas, you shouldn't think about doing HIFU, with exception if the patient said, I do not want surgery, I do not want medicaments. But there, of course, the first solution would be radical treatment. But in our infertility patients, where they want to be as conservative as possible, I think HIFU is safe, feasible, with a high success rates. And if you see the pregnancy rates after HIFU treatment in China, it's fantastic. I don't know whether it's all true, but my impressions, I've been many times to China, those guys are very well working, and I believe their statistics, and we should at least think about giving this technique a chance for our infertility patients.
I see. And I think we have some the expert join us, but do you want to share the experience? Professor Kiwali is here, but I'm not sure he's available for share his experience. Professor Lee, if you are please feel free to share your experience. Okay.
Yes.
Oh, you hear me?
Yes.
Hugo, you're doing a very, very good job, and I appreciate you're one of the brave ones from Europe and a longtime friend of Asia and Southeast Asia to speak on behalf, not just because it is a China invention, but because you wanted it for your patients and those, especially infertility. And you are right, for those who are scared of the knife. Hugo is very humble, but I can tell you, this man will make the HIFU fly when you get the chance to lecture and to demonstrate in due course. Yes, I heard the question about what are the fibroids that is amenable to HIFU. He is very right, infertility and those who date against surgery. But the type of fibroids, I think that's what you are pointing at, is number one, if it's pedunculated, like a tree and a trunk, then that fibroid will not be so responsive to HIFU, because when you hit you imagine a tree, when you hit the leaves and branches and all this of the absorption really depends on the trunk. So you have to bring the dead tissue debris away, but because it is a pedunculated fibroid, the way it's absorbed is very slow, and the failure rate is usually quite high. Secondly, because it is pedunculated, you can just imagine the risk of bowel and intestines wrapping around, like embracing you. So again, that is a risk factor, and most of the HIFU practitioners will advise against it. Then it comes to the intramural. I think on the classification is 3, 4, 5, I think, in the FIGO classification. Most of the intramural will be and should be and can be treated with HIFU. Of course, the question is, what's the rate of response? The rate of response really is very biological and very technical. Technical involves the HIFU energy which you can deliver, and that comes with skill and experience. And biology really depends on whether the fibroid, if it's under MRI, is it hyper-intensive or hypo-intensive? That I mean, when you look at the MRI, is the fibroid very vascular or relatively avascular? So that determines on the biological effect of the response when you hit with HIFU. Then the $1 million question comes if it's a submucous fibroid. Very interesting.
Yeah.
The simplest thing to do if you have a submucous fibroid, and everybody in the world will say that less than 3 centimeters, yes, probably it's easier to take it out from a resectoscope, a hysteroscope. But when it's something big, there are 2 things I think, no hard and fast rules, really depends on your experience and skill levels. One, you can use HIFU to treat it first until it becomes much smaller. And then sometimes there's luck in such a way that you will be passed out or given birth to the submucous fibroid. And we have experience like that. But the danger in doing HIFU for submucous fibroid is, if it is going to be an infertility patient, you may damage the endometrium as well. So again, it's a judgment call on the part of the gynecologist. Next, if the patient is already completed family, has menorrhagia, and she would not mind having less menstruation or amenorrhea, then I think it's fine to treat the submucous fibroid with HIFU. Okay, that's my 2 cents worth. I must say it's good to look at a very senior professor like Hugo, a friend of mine, familiar face. And then it's also very, very interesting for me, heartwarming to see a young professor like you talking about this subject, which is slowing take up in many parts of Europe and the West, but it is certainly something which is has happened for the past 10, 20 years in China, Korea, Taipei, Taiwan, and now, of course, I'm just one of the fortunate ones to get hold of the machine. But yes, Professor Hugo is correct. He has been a long-time friend of this region, and when he spots something, usually he spots a winner. Okay, over to you.
Yes, thank you very much, Professor. So I think due to we have a limited time. By the way, I think this is just the first time. We have like a second time, the third time after we have more information. Professor Hugo, is it okay for you to talk again in the near future?
Oh, absolutely. I thought this was the, or shall I say, the trial version, and because we just talk a little bit about indication in the machine, but that's like saying laparoscopic surgery for infertility. We can talk about that for days. So next time we should talk maybe about adenomyosis, about pancreatic cancer, about osteoblastomas, about prostate and HIFU, things that are not interested for us as gynecologists, but if we are interested in HIFU, we should think what HIFU can do also in other fields of interest. By the way, Olarik,
Okay.
Olarik, it wonders me that there's nobody from China
Yes,
who is
that's
asking questions.
oh, Rosie is here. You know Rosie,
Who?
right? Rosie.
Rosie is there. Rosie is is from the leadership in Chongqing. She is
Rosie, could you please to share your
in
experience?
Tucson.
Sorry,
Rosie.
yes, I also in my casual wear. So okay, but let me see if I can open my.
Yeah, Rosie, even in casual wear, it's
No, it's
very.
okay. It's I am trying to. Okay, so sorry. Okay, let me try to pull it up from my.
Yeah.
Okay, so is my open? Yeah, I think it's opening up right now. So it's glad to see everyone, especially Hugo, and also Kiwi Lee, and lots of familiar face. Oh, here I am. Sorry.
There you are.
Yeah, I'm wearing the headset. So thank you, Hugo, for giving introduction to this new technology. Okay, and as Hugo says, I think for any technology coming out of Asia, especially in China, okay, this is the reverse journey to what people are used to receiving on this end, okay? But I think, so the ESG has made the decision to establish this working group under the leadership of Hugo and Professor Rudy, okay? So I think this marks the a new beginning of this technology. And I think it's very important to introduce this, as Hugo says, introduce this technology in the scientific way, okay, in the way that is backed up by clinical evidence, although the Chinese team has done a tremendous job and over 20 years, okay, and produced a body of evidence and published in esteemed journals. For this technology to be adopted internationally, I think we need different parts of the world to start to take a serious look of this technology, like the ESG does, like the APAGE does. By the way, APAGE has also formed a HIFU group. Actually, I think Professor Lee is part of that group, and that group is under the leadership of Professor Qilong Li. Okay, so, and for me, myself, actually, I was a professor at the University of Chicago, and my background of training is oncology. So when I, on an unexpected visit to China and to Chongqing Medical University, and met this technology and the team of Professor Wang, it occurs to me, this will be the future for cancer treatment. It's a brand new direction because it's a physical element. It will overcome the drug resistance problems that the current therapy is very hard to go by, okay? So that visit had changed my personal career. So I let go my University of Chicago professorship, actually accepted a professorship from Chongqing Medical University, okay, and returned to China after I left China for 20 some years, okay. So, and I also had the opportunity to work, I have my own lab and a university, okay, still doing cancer type of work, but on the clinical side, I had the opportunity to work with Chongqing HIFU to help them to reach out for the international medical community. Okay, so so therefore, this can be reached to the west or the other parts of the like the my role is the bridging the gap. Okay. And so, but very happy to see everyone, and so that's something. Thank you, and for me to have the opportunity to say things like this.
Yeah, thank you, Rosie. Who is Professor Pongsak Yonggam? Who is that?
Pongsak, I think it's from Dr. Lee might know him, I think.
Yeah. So I see
Ask
I
the
see
QA.
here. Pongsak Yungang. Can you hear me, Professor? No.
No, no.
No.
No, sorry, I do not know
Oh.
Professor Pongsat. Usually the Thai doctors I know are those who are very active in APAGE. So I would now like to invite Olarik to join APAGE activities and
Yes.
and be in the family, because Hugo comes to join APAGE activities very often.
Yes.
Maybe after that I'll ask Tony to contact you and so that you can join the APAGE activities.
Thank you.
Yes.
Thank you. You know, actually, for APAGE this year in Chennai, I have some auditor of the books, but I'm not sure this year we can have the APAGE in India
I
because
think
of
it's been, yes, correct. It's been shelved. Unfortunately, it's been shelved. Regret to say that, but I'm sure the incoming president, which is Professor Prashant, I think he will organize something, because every year we have a change of presidents in APAGE. So if you join one of these days or one of the years, you will see President Olarik as president of APAGE. And we retire. It's time for us to retire.
Thank you.
Professor Lee, do not forget that we plan Olarik as a president of ESG.
Oh, really? Okay. All right.
Yes.
All right.
Yeah. We are flirting with him now since 10 years.
Okay. So I shall not steal the thunder from ESG.
No, he can be the president of APAGE, ESG, AGL.
Did you say AGL? Did you really say AGL? You have to ask Donald Trump that.
Oh, yeah. So I see many names here. Unfortunately, there are no pictures. So up to you now, Olarik, what we're gonna do. I think all the people had an overview of what I think, why I think that HIFU is a good option, and that every gynecologist should have in his mind HIFU as a treatment option for the infertility patients with myomas or adenomyosis, as an alternative to medical treatments and laparoscopy or laparotomy. That is my opinion. So it's one of the 4 options, and in our minds, HIFU is getting more and more on the first or the second place, together with laparoscopic therapy. But who is going to do laparotomy now on a uterus full of myomas? And Rosie told me in South Africa, there the women at the age of 25 have the uterus full of myomas. They have only one possibility there: take out the uterus. Yeah, nothing else worked there. Well, I think we should be sure that those people know about HIFU, and that we can save a lot of uteri. What is uterus?
Uterus.
Yeah. So that we can save many uterus in patients with infertility, also in Africa and South America. So that is my final remark.
Yes. So I think the next step after the recovery phase, after the COVID, I will go to Chongqing. Okay.
Welcome. Yes.
Actually, last year I had the opportunity to go to Chongqing in an APAGE meeting, but unfortunately I cannot go. But after this section, I will go to train for the HIFU, and who knows? Because in Thailand we have only one machine, and it's not used fully of the utilization. So after
I know that.
I will go to train. I will go to train.
Olarik,
Yes.
Yeah.
sorry. But can I just ask, where in Thailand is your HIFU machine? Which hospital?
In
Who is
Bangkok, is a World Medical Center.
Yeah.
World Medical Center in Bangkok.
Mm-hmm. Okay, sure.
Olarik, who is asking that? Is that Professor Lee?
Yes.
Yes, I did.
Oh, hi, I'm sorry. Yeah.
Right. So, no, the second thing I want to add to what Professor Hugo has said is, we are sometimes so academic and we always ask for evidence-based. Sometimes we forgot to look from the direction of the patient because we have algorithms, we have flow charts, and we decide for the patient. I think that's wrong in the modern world. If you just go home and ask 10 females, your aunties, your mother, your sisters, just tell them, if you have a fibroid, you want to face the knife or you want to face the music, which is HIFU, high intensity focused ultrasound. You will get the answer. And that is the answer you get, and that's where you plan your treatment for the patients. It's really a no-brainer.
So this is very interesting. Face the knife or music.
Yeah. Olarik?
Yes.
There are, of course, many people now waiting to go to Chongqing. And also, we want soon to have in Oldenburg, in the clinic of Professor Rudy, we want to have an ESG training center for HIFU. The problem is, of course, at the moment, it's very difficult to go to Chongqing. It's practically impossible. So we have now 5-6 people from the team of Professor Rudy. Also in Dubai, we are going to open an HIFU center with Professor Ayaz Devasi. He is very interested in India together with Prashant Masesiskar, but all the people, they cannot go now for training at the moment. Rosie will confirm that.
Yes. Yeah, but we hope but China is I'm still being out of China because of the travel ban. Okay, but I think as the world work together, we hope so. Okay, so if this situation is under control, then we can activate the training and the visit. Okay, but also I want to mention one more thing is that actually it's way before the COVID, but now COVID made us realize that going online is as important as offline. Because without online, we cannot have a talk like such a Zoom talk. Okay? So we are also developing primary trainings online. Okay, so therefore, and also there are more and more private doctors in private practice that's joined to be interested in this technology and set up the private practice around this technology. And we also know that the time, the clinical time of those doctors will not allow them to come to Chongqing to learn for 1 month or 2 months, okay? So therefore, we are also working to optimize our training program. And down the road, we also hope to, as Hugo and Kiwi says, we're going to join the force of APH, ESG, and other, OB/GYN societies to deliver the training all together, okay? So therefore, to answer Hugo's question, the offline training is depending on the COVID-19 situation right now, okay? But China is probably the safest place right now, okay? It's the travel ban. So, but in complementary to offline training, we also have this telemedicine center. So even during the COVID, there's one number I want to share, okay? And we piloted the treatment numbers from South Korea, Taiwan, Hong Kong, and Singapore from January to March, the first quarter. So for everyone know, this is pretty much the most severe COVID situation in Asia. And guess how many patients all these centers have treated in this first quarter? 942 patients.
Wow.
What?
Okay, so this is the real. 942 patients. This is remarkable, okay? And why? Because the HIFU center can be set up in the off-hospital situation, okay? So therefore, okay, even in the hospital, like Dr. Lee's in the Ferry Park, it does not require operating theater, does not occupy the essential medical resources that's so precious for the COVID-19. And also, because there's no contact between the doctor and the patients during the treatment, that already naturally obeys the social distance rule of, you know, so therefore, the patients can still go for the treatment, okay? And I think as Professor David Cranston, or Oxford director, gave in the French webinar 2 days ago, and he says, you know, he believes after COVID-19, technology, non-invasive technology, exemplified by the HIFU, will have a bright future because the world is facing the threat of 17 years ago, it was SARS, then it's the MERS, now it's the COVID. Who knows what's the next, okay? And so therefore, I think online, so we also, how can we do that? 924 cases, and some of the centers are quite new centers, okay? We're still under clinical support, but we cannot send the doctor physically during the COVID-19 situation. So we deliver the service through our telemedicine center, okay? And Dr. Lee can, and also very interestingly, in the March 8th, on the International Women's Day, in response to a proposition by Dr. Kiwi Lee, okay, we did a 42 center synergized event to celebrate Women's Day, utilizing the telemedicine service, okay. So now we're expanding in the service in Africa. So how we can do it? So we have to build an online operation platform so that it will not be interrupted by this situation. And why this technology is particularly suited to do that, because it's completely digitized, okay? So therefore, okay, you can do the big data. And what would the big data for? All of us, the doctors. So that will help us down the road to use AI technology to optimize the treatment protocols, actually based on the racial characteristics, okay, based on different type of myomas, okay. And so the biggest data big data center is also behind the telemedicine platform, okay. So we're actively ramping up our training program and the clinical service, and we even delivered post-cell the maintenance service during the COVID through online platforms, okay. So just so I think this is the direction which we will go to when we deliver the medical service, to take a consideration of the scenarios that COVID-19 inspire us, okay, to think forward, okay, how to deliver the service more effectively. Okay, thank you. And welcome, and we're looking forward to your visit after COVID-19.
Okay.
Well, Olarik,
Yes.
such a nice invitation by a very brilliant and very good-looking lady. She's professor. She's, well, that you cannot refuse to do, eh?
For
You
sure,
must
for sure.
go.
After
Thank you.
COVID.
Thank you, Hugo.
After the COVID.
Okay.
And also, yeah, and it's also so interesting, Hugo. So I think that this format of discussion, small group, okay, it's very good. Okay, I think it's more casual, and people can ask the questions, not just about the scientific part, as Kiwi says, to deliver this new service for people, for doctors actually to learn, and for patients to receive the service. There's from the academic author down to the clinical. And this process usually in the very formal conferences, it will not touch about these topics, but in such a small online platform. I think it's a golden opportunity to bring the doctors, the business, and everyone together to think how to discuss how to deliver this in the way that is fits the doctor and fits for the patients. We should do this often.
Olarik,
Yes, definitely agree.
I propose to give the final words to the man between us who has the most of experience with this technique, Professor Lee from Singapore. I see him now, my dear friends. And he's the only one of all of us who has really, okay, Rosie, of course, also, but Professor Lee has, how many did you do now? 200, 300?
No. Personal, 91 cases.
Okay.
91.
So let's say 100. Maybe you should give the final word to him, Olarik. What do you think?
Okay, this is first and foremost, before I forget, say hello to Professor Gill of Vienna for me.
Yes.
Yes, please. I think if I were Professor Olarik and you are into infertility and all this, there's something for you to do first for your university or hospital, second for your patients, and third for your country, to bring new technology into Thailand. That's because, you know, why do we move from open to minimally invasive to something non-invasive? The aesthetic people will say, yeah, no scars. For us, most of us say less pain and go home earlier. But I think the wonderful thing is you are preserving the fertility and the femininity of the female body. And I think there's some spirit which we all doctors, especially gynecologists, should uphold. Thank you.